everyone, this is Callie Reed, and I made this video for my patients that are using semaglutide and they are not actually coming to our office, that you are receiving these at home. So I want to give you a quick instruction how to mix the medication and how to inject. I was on it for 3 months. I lost 18 pounds, and now I've been off of it for 4 weeks and I'm maintaining my weight. For this purpose, I'm just gonna show you how to inject. I'm not gonna inject it myself, but I'll show you. Okay, so you will receive semaglutide in powder form, and you're gonna also get a sterile water. First, top the tops. Then you will draw up 5 cc of sterile water. You want to make sure there's air in there. You inject the air. You don't have to wipe the tops of these vials because they are brand new, sterile considered. 5 cc of sterile water. Then you would inject it into the semaglutide. As soon as you mix it up, it's gonna basically kind of suck in because it's a closed container. You withdraw and you mix it. You would keep this in the refrigerator once it's mixed. The vial will have an expiration date. It says you have to use it by August 27th. It's good in the refrigerator until that day. Okay, so you want to scrub it around. And according to the protocol, everybody should be starting at 0.25 milligram, which is a 25 milligram on the insulin syringe. So you want to make sure all the liquid, it's all liquid. There's no powder in here. Then you always want to withdraw some air into the vial. So you would, according to whatever your dose you're going to be using, first one is usually 25 units. You would draw up, you put 25 units of air in here, then you would put the air in here first and withdraw the medication. At 25. Then this is all ready for you. You can cap it back in here for now. You will also get alcohol wipes, clean the area of the skin. It's usually given in the abdomen in the subcutaneous tissue here, and wanna grab your skin and put it in and inject. So I recommend giving yourself injections once a week, same day, and roughly same time. It takes a day for you to feel the medications, and as you know, constipation is very common, nausea, vomiting is very common. These happens when you don't eat for too long, or sometimes if you overeat, your stomach gets filled up. The food will be in your stomach longer because it slows down the gastric digestion. Because of that, you feel constipation and nausea after eating too much. I recommend eating your meal earlier on in the day. Typically what I do when I was on a medication was I would have lunch around 1, 2. Rest of the day I felt full. I didn't have to eat dinner. When I first started, I would automatically think, oh, I should eat. But I wasn't hungry, so I was making myself eat. But you actually really don't have to do that. So that's all for the semaglutide. You will also get the B12 injection. This is amino acid that helps to break down fat carrier cell. It prevents cholesterol buildup, and it also gives you energy. So you're gonna get a package of another insulin syringe with 100 units. Actually, both of the syringes is gonna be 100 units. But you can use this. One of them will be longer. One of them will have a longer needle. You can use this to inject into the muscle. So you will always draw some air, Put it in here, put the air, and withdraw. It does take a little longer to withdraw because of the size of the needle and the volume you're getting. So this goes in your muscle. You can have your friend, family member give it to you in your arm, your deltoid muscle. If you are alone, you can definitely give it to yourself in the thigh. 1 second, it's coming. Okay, this is all ready. What I do is clean the area. You can give it in your thigh like this. It actually doesn't hurt. These needles are pretty small, so you just give it in here and then inject. That's it. Hope you have a good success. If you follow our instruction and protocol, you will definitely lose at least 10 pounds in 2 months. We also recommend that, if you can, do intermittent fasting while you're doing this therapy, and you're gonna have an amazing result. Thank you.